Yoga for Pregnancy and Prenatal Care. This course focuses on gentle, modified poses and breathwork, tailored to the changing needs of each trimester. In this guide, we will explore safe yoga practices during pregnancy and provide prenatal yoga sequences suitable for the trimester and to support the health and well-being of both mother and child.
Downward facing dog. If you have wrist, shoulder or back issue, practice with caution and consider modification. Avoid over-strengthening your legs if it causes discomfort in the lower back or hamstrings. Pregnant individuals should practice with a wider stance to accommodate the belly. Begin in a tabletop position. Hands should be shoulder width apart and knees hip width apart. Inhale, tuck your toes and lift your hips up towards the ceiling. Press your palms firmly into the mat. Spreading your fingers wide, distribute weight evenly. Keep your legs straight while maintaining a slight bend in the knees. Ground your heels towards the mat. Engage your core and draw your belly button towards your spine. Lift your sitting bones up and back. Create an inverted V shape with your body. Lengthen your spine, reaching your tailbone towards the ceiling. Keep your head in line with your upper arms. Look towards your navel or between your thighs, allowing your neck to relax. Breathe deeply and evenly. Feel the stretch and expansion in your back and hamstrings. Hold this pose for a few more breaths. This pose stretches and strengthens the entire body, particularly your arms, your shoulders and legs. Relieves tension in the spine and promotes better posture. It increases blood flow to the brain, enhancing mental clarity. Encourage flexibility in the hamstrings and your glutes. It builds core, strength and stability. Exhale. Slowly drop your knees, come back again into tabletop position. Release the pose. Virabhadrasana 2, Warrior 2. Avoid if you have knee or hip issue. Modify the pose if necessary. Use any prop. Start in mountain pose. Step your left foot back, creating a wide stance. Front foot forward, toes ahead, back foot perpendicular, toes sideways. Bend your front knee over your ankle. Open up your hips to the side. Face your chest to the side. Gaze over the front fingertips. Extend your arms out to the side. Relax your shoulders. Engage your core. Maintain your straight spine. Hold the pose for a few more breaths. Inhale deeply and exhale. It strengthens the legs, especially your quadriceps, enhances the stability and balance, improves flexibility and opens up the chest. Exhale, lower your arms. Step your left foot forward. Continue with other side. Start again in mountain pose. Step your right foot back, creating a wide stance. Front foot forward, toes ahead, back foot perpendicular, toes sideways. Bend your front knee over your ankle, opening up your hips to the side. Face the chest to the side. Gaze over your fingertips. Extend your arms out to the side. Relax your shoulders. Engage your core and maintain a straight spine. Hold the pose for few more deep breaths. Inhale and exhale deeply. Exhale, arms down. Step your right foot forward. Chair pose. If you have knee issues or injuries, practice chair pose with caution.
You can modify the pose by bending your knees less or using a chair for a support. Individuals with low blood pressure should be cautious when it's coming out of the pose, as it can cause a sudden drop in your blood pressure. Begin in a mountain pose with your feet together and your palms at your side. On an inhale, raise your arms over your head, reaching them upwards. As you exhale, bend your knees and lower your hips, as if you are sitting back into an imaginary chair, keeping your knees over your ankles and your thighs parallel to the floor. Engage your core muscles to maintain a straight spine. Bring your palms together in a prayer position at your chest, or keep them shoulder width apart with your fingers reaching up towards the ceiling. Gaze forward or slightly upward, keeping your neck relaxed. Hold this pose for several breaths, maintaining a strong and steady posture. This pose strengthens the quadriceps, hamstrings and glutes, tones the core muscle including the abdominal and the obliques, improves balance and stability, enhances posture and alignment, engages the muscles of the lower back. To release, inhale, straighten your legs and return to the standing position. Exhale, lower your arms back to your side. Half moon pose. If you have balance issue, practice near the wall or use a block support. Individuals with hip or lower back issues should be cautious when performing this pose, may need modification. Begin in a Tadasana mountain pose with your feet together. On inhale, shift your weight to your right foot and slightly bend your right knee. On exhale, begin to hinge forward at your hips while keeping your right knee slightly bent. Simultaneously, extend your left leg straight to the back behind you. Your right hand should be on the floor directly beneath your right shoulder. Slowly start to raise your left leg and your left arm, creating a straight line with your body, like a half moon. Open your chest and your hips to the left while stacking your left hip over your right hip. Gaze at the floor to maintain the balance and keeping your neck in a neutral position. Hold the pose for several breaths, feeling the stretch in the hamstrings and the side body. Be here for a few more deep breaths. This pose strengthens the core, legs, and your lower back. It improves balance and stability and coordination. To release, slowly lower your left leg and your arm back to the floor, returning into an upright position. Switch to the other side, keeping your left knee slightly bent, simultaneously extending your right leg back behind you. Your left hand should be placed on the floor directly beneath under your shoulder. Slowly start to raise your right leg and your right arm, creating a straight line with your body, like a half moon pose. Open your chest and your hips to the left while stacking your left hip over your right hip. Gaze at the floor to maintain the balance and keep your neck in a neutral position. Hold the pose for several breaths. Feel the stretch in the hamstring and the side body. Be here for a few more deep breaths. This pose stretches and opens up the hamstrings, your groins, and the side body. Enhances focus and mental concentration. It engages the muscles around the hip joint. To release, slowly lower your right leg, arm back to the floor and return to the upright position. Malasana. If you have knee issue or discomfort in your ankle or hip, use props like a block or cushion to support to your sitting bones or heels. Gradually work on your flexibility. Pregnant individuals should be cautious while practicing Malasana and it may be more comfortable to modify the pose and to avoid it in the later stages of the pregnancy. Begin in a standing position with your feet hip width apart. On exhale, slowly lower your body into a deep squat by bending your knees. Your feet should be slightly turned out as you descend your torso forward slightly, so your elbows can fit snugly between your knees. Bring your palms together in a prayer position at your chest, using your elbows to press your knees gently apart. Your spine should be relatively straight and your chest open. Gaze forward or softly at the floor, keeping your neck relaxed. Hold the pose for several breaths, feeling the stretch and opening of your hips. This pose is excellent for opening the hips and improving flexibility. It strengthens the muscles in your thighs, calves, and your lower back. Compression of the abdomen in this pose can stimulate digestion and can help to relieve constipation. Malasana is a grounding and centering pose that can help calm the mind and reduce the stress. To release, bring your hands to the floor, lift your feet and stand up. Bridge pose. Avoid if you have neck or shoulder issue. If you have lower back problems, use cushion or consider modification. Lie down on your back with your knees bent, feet hip width apart, and arms at your sides, palms down. Inhale, press into your feet and lift your hips up towards the ceiling. Roll your shoulders under and interlock your fingers behind your back. Lift your chest gently towards your chin, keeping your neck long and gaze towards your knees. Breathe deeply and evenly. Stay here for a few more breaths. Inhale and exhale deeply. Bridge pose. It strengthens the back, glutes, and legs, improves spine flexibility and posture, relieves lower back pain and mild depression, opens chest, improves lungs expansion. Pregnant women should practice with props. Keep your neck aligned with your spine and avoid overarching the back. Exhale and slowly lower your hips. Relax your palms.
Butterfly pose. Practice with caution if you have a history of hip or knee injuries. If you experience pain or discomfort in the knees, use props like cushion or blocks under your knees for support. Pregnant individuals should practice this pose with modification and avoid deep forward bending. If you have any groin injury or discomfort, avoid pressing your knees down too forcefully and practice gently. Begin by sitting on the mat with your legs extended. Bend your both knees and bring the soles of your feet together. Allow your knees to fall outward, creating a diamond shape with your legs. Hold your feet with your hands, interlocking your fingers around your toes. If you can't reach the toes, you can hold your ankles or your shin. Inhale, lengthen your spine, lift your chest, keep your shoulders relaxed, away from your ear. Gently press your knees down towards the floor without forcing them. Feel a stretch in your inner thighs and groin. Breathe deeply and evenly, inhaling through your nose and exhaling through your nose. With exhalation, allow your knees to naturally drop closer to the floor, Inhaling, lifting the knees up, and exhaling, dropping your knees down. Continue with this motion. This pose opens up the hips and groin area, relieving tension and discomfort. It stimulates the abdominal organ, promoting a healthy digestion, ease menstrual discomfort and symptoms, helps to improve flexibility in your hips and your thigh muscles. This pose encourages relaxation and can relieve stress. Relax the pose, extend your legs forward. Janu Shirsasana. Avoid if you have a knee injury or any discomfort. Use props such as cushions or a yoga block under your bent knee for the support if needed. Begin in a seated position with your legs extended. Bend your right knee and bring the sole of your right foot to the left inner thigh. Keep your left leg extended. Square your hips to the extended legs. Inhale, lengthen your spine. Exhale, fold forward over the left leg. Reach for the toes or the shin. Keep your back straight. Inhale deeply through your nose and exhale through your nose, or you can exhale through your mouth. Continue to breathe deeply as you hold the stretch. Janu Shirsasana stretches the hamstrings, groins, and lower back. It calms the mind and reduces anxiety. It helps with the digestion and massages the abdominal organ. Exhale and release. Now let's go with other side. Bend your left knee and bring the sole to your left foot towards the right inner thigh. Keep your right leg extended. Square your hips. Inhale, lengthen your spine. Exhale, fold forward towards your right leg. Inhale, reach for your toes, or you can reach towards your extended leg. Keep your back straight. Inhale deeply through your nose and exhale deeply through your mouth. Continue. Breathe deeply and hold the stretch. It can relieve mild headache and menstrual discomfort. Pregnant individuals should practice with caution and support their belly during the forward bend. If you experience any discomfort, back off from the stretch and avoid forcing the movement. Be here for a few breaths and exhale slowly. Relax and come all the way up. Extend your leg forward.
Shavasana. Ensure your head, neck and spine are in neutral position and comfortable. If you have difficulty in lying flat, use props such as cushion under your knees. Lie on your back with your legs extended and arms relaxed at your side, palms facing up. Allow your feet to naturally fall open. Close your eyes. Take a slow and deep breaths. Let go all muscular tension, allowing your body to feel heavy and completely relaxed. Focus on each breath, releasing any remaining thoughts or worries. Savasana promotes deep relaxation and releases stress, enhances body awareness and mindfulness, improves sleep quality and overall well-being. Stay warm with a blanket or a shawl to prevent chill. If you fall asleep during Savasana, it is meant for deep relaxation. Anulom Vilom. Avoid if you have any respiratory issue such as cold or nasal congestion. Practice with gentleness. Avoid forceful or rapid breathing. If you feel dizzy or uncomfortable, return to your normal breathing. Sit in a comfortable position. Keep your spine straight, neck straight. Use your right thumb to block your right nostril. Slowly and deeply inhale through your left nostril. Fill your lungs full of air and focus on your breathing. Release your thumb from the right nostril. Now block your left nostril with your ring finger and exhale slowly through your right nostril. Keep the alternating between the two nostrils. Inhale through your left nostril. Exhale through your right nostril. Inhale through your right nostril. Exhale through your left nostril. Continue with deep breathings. This practice balances and calms the nervous system, reduces stress and anxiety. It enhances lung capacity and respiratory function, improves focus, concentration, and mental clarity, clears and purifies the energy channels, promotes a sense of balance and well-being. Exhale through your left nostril and release. Loving and kindness meditation is a beautiful and heartwarming practice that not only benefits your emotional well-being but can also a nurturing and loving environment for your baby. It encourages feelings and deep connection and empathy, fostering a positive atmosphere for both you and your child. Find a comfortable space to sit or lie down. Close your eyes, take a few deep breaths to center yourself. Begin by directing loving and kindness and well wishes towards yourself. Inwardly repeat these phrases or adapt them to your own words, feeling the intention behind them. May I be happy. May I be healthy. May I be safe. May I live with ease. After a few minutes, shift your focus to your baby. If you are expecting a baby, direct your well wishes and love towards your unborn child. If your baby has already been born, visualize them and send them the same love and kindness. May you be happy. May you be healthy. May you be safe. May you live at ease. Continue to extend your well wishes to the others in your life, such as family, friends, or anyone who needs your love and compassion. You can also include individuals you may have difficulties or those who have passed away. If your mind becomes distracted or negative thoughts arise, acknowledge them without judgment and gently return your focus to your loving and kindness phrases. Spend as much as time you wish in this meditation. Gradually extend the circles of loving and kindness to include all beings, known and unknown. May all beings be happy. May all beings be healthy. May all beings be safe. May all beings live at ease. When you are ready to conclude, take a few deep breaths and gently open your eyes.